Hi, this is Dr. Gordie, and welcome to another episode of the Adventures of the Kilted Chiropractor. One of the most difficult things to explain is applied kinesiology and muscle testing and what it is. We actually use the muscles of the body to find out what's going on with the energies inside the body, the chemistry, and the structure. And how do we do that? Because every muscle relates to a gland or organ and an acupuncture meridian. You know, acupuncture meridians are energy flows that are in the body, and they have a specific function, a specific place in the body. We'll deal with that in another time. But the way we test it is at every single muscle, we can test the muscle's function. And if the muscle isn't functioning the way it's supposed to function, then we can use that muscle to find out if it's a problem with the meridian and its flow, and anywhere that meridian flows, if it's a problem with the organ or gland that relates to it, and that would mean the chemistry of that gland and any toxicities that may affect that gland or organ. And we can also find out that muscle, if it's a problem with the structure that relates to the muscle, the nerve supply, the blood supply, the lymphatic drainage. We ask the body, using the muscles, to find out what is the blockage in flow of any of those factors, and then we can apply a correction and correct the thing that's off, whatever it is, and then retest the muscle. And when the muscle turns back on, we know we've applied the proper therapy, and then we can continue to apply that therapy over time if needed. For example, the pectoralis major clavicular, it's a muscle right here. It's one of your push-up muscles. It is your bench press muscle. This muscle right here on both sides, it does this motion, but it relates to the stomach organ and the stomach meridian. So if you have a problem with it, then we have to ask the body, is the problem coming from the muscle itself, the muscle attachments? Is it coming from the nerve supply to the muscle? Is it coming from the organ, which is the stomach, or the meridian? And the meridian flows all the way down even to the foot. So you could have a problem with a bone in your foot that's causing that meridian to be blocked. If it turns out to be, for example, that the organ is involved, then you would ask the question, well, what's wrong with the organ? So then we could introduce things that may be helping the organ. And in this case, if it's the stomach, for example, if the stomach isn't producing enough hydrochloric acid, which is related to zinc, the mineral zinc, then we could substitute zinc, put zinc in the person's mouth, and we can retest the muscle. And if the muscle changes, and we know that will help, it could be that we need to give hydrochloric acid in beta-E and HCl, and that's a supplement like Hypo-D from Nutri-Rest, which we use a lot of in the office, and we can supplement that to get the muscle to work. It's not always about making the muscle work. The muscle is an indicator for what might be going on in other systems. So sometimes we're just fixing the muscle. If you've just injured the muscle, you can fix the muscle. If you've affected the neck, and the neck is out of place, and we need to adjust the neck or fix adhesions, which is scar tissue in the neck, that would turn the muscle back on. Or we may need to help the meridian flow, so it turns the muscle back on. But sometimes it's the organ relationship. The stomach can also relate to the emotional reflexes, so we may have to deal with emotions to turn that muscle back on. So the simple asking of the question, how does this muscle work against resistance, can open an entire universe of possibilities that allow us to make corrections that then not only fixes the muscle, but changes the entire human being.